you see like Coca-Cola and these soda companies funding physical activity programs, right? They're trying to really say that, hey, the problem is over here. It's not us, right? If the problem behind our obesity crisis is physical activity, and really that's where the focus should be, they are intentionally taking the focus off them, right? Like, don't look at the sugar-sweetened beverages. Don't look at the processed foods. Let's go look at physical activity. I'm Dr. Vinu Ilakkuvan, founder and principal consultant at Pop Health, and you're listening to the Public Health Insight Podcast.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content.
What if the biggest factor shaping our health isn't our doctors, our diet, or even our zip code, but the unseen influence of corporate power? We've all heard about the social determinants: housing, income, education. But what if those are just symptoms of something deeper? In this episode, we're going further upstream to expose the real root cause, power itself, and how corporations wield it to shape not just our health, but the very choices available to us. We're joined by a public health disruptor who's made it her mission to expose how corporate interests manipulate narratives, shift blame to individuals, and undermine our ability to organize for change. Together, we'll trace the flow from corporate influence to real health outcomes, explore why public health professionals feel trapped within broken systems, and discover how building community power might be our way out. From PHI Media, I'm Purva Mehta, and joining me for a conversation about reclaiming our health from corporate control is Vinu, a leading advocate for change. Vinu, when we talk about health inequities, public health usually points to the social determinants of health. I think that's often quite hammered into us all throughout our MPH or undergrad or even your DRPH, things like housing, income, and education. But you said that those are only part of the story. What's exactly underneath them? Can you run us through what is like maybe that visual lens of really peeling back the layer and seeing what's underneath?
Yeah, exactly. So I often think about this when I first started in public health, that upstream model and story really captured my imagination and my attention. So I often think about, right, we're going upstream, and in public health, that started with a conversation around social needs, right? So when someone shows up at a hospital and they have these other social needs, they don't have access to healthy food or to housing, how do we address those social needs? And then in public health, I think we walked a little bit further upstream to thinking about social determinants. So not just at that individual level, but really at a community level. How much healthy housing is available? How many grocery stores do we have? What's the built environment like? What are the schools like? So these community level social determinants. And then I feel like much more recently in public health, we've kind of inched towards thinking about what's further upstream than that, right? We've started to hear a little bit of talk around the idea of structural determinants, around things like governing structures and racism. And I think that's definitely a movement in the right direction. What I see is that there's something even further up the stream that's shaping everything else. And it's something we don't name explicitly often in public health, and that's power. So who has the power over what stories we tell, over what policies we pass, over what programs we're investing in, over who we're prioritizing and who we're marginalizing? I think there's all kinds of power, right? There's narrative power, political power, financial power. And right now, neither we in public health nor the communities we serve hold nearly enough power on any of those fronts. And corporations and corporate interests hold far too much. So to me, the root causes behind the root causes, I think really boil down to power, the power dynamic that I think is most deeply affecting public health right now is the imbalance of power between corporations and corporate interests and then actual communities.
Yeah, I mean, it's happening all over the world, not just the States or anything, but the amount of sway that corporations have on just our government to be able to change perceptions, to change allocation of funding and things like that. And you feel so helpless to be able to even do anything. Once you know that this is an issue and there are like invisible strings in every aspect of society, it becomes so difficult to think like, well, how can I possibly go up against that? Especially as public health professionals, like we're taught to find these strings and then work with them, first of all, and then try and help all the communities that are affected by it. But what if public health itself is the one that's affected by it? You know what I mean?
So right. I love the analogy of sort of the strings and working within, because you're right. I think oftentimes we in public health are taught and modeled, right? How do we work within the existing power structure to make change? And I don't want to diminish the importance of that because, yes, like changing power structures takes a long, long time, generations even. And it is important that we do what we can to make change right now as well. But to me, the problem with only focusing on what change we can create within the existing structures is that we in public health, and I've seen this in the work we've done with community coalitions, right? Like we in public health are often pushed to the margins, right? We're pouring all this effort into making these little marginal changes around the edges of this existing structure. And it is fundamentally not going to get us to the kind of transformative community health changes that we are aspiring to in public health. And so I really want us as a field to think about what we can do to address those structures themselves, because until we do, I don't think we can realize the true promise of public health.
Absolutely. And maybe there's an opportunity here for public health professionals to, obviously we need to look at social determinants of health, but maybe even backtrack further and look at those commercial determinants of health first. So what would you think would change with the way that we work or the way that the systems that we work in? What would change if more public health professionals started looking at commercial determinants of health before they looked at the social determinants of health, or alongside it maybe even?
Yeah, I was going to say, I don't know if it's sequential in the sense of looking at one before the other, but I do think that we are not going to be able to transform those policies and systems around social determinants. We're not going to be able to transform them in meaningful ways until we address the commercial determinants head on.
They're called the commercial determinants of health. How private sector activities shape population health through products, marketing, distribution, and policy influence. Tobacco, alcohol, ultra-processed foods, and fossil fuels. These aren't accidents. They're commercially produced and aggressively promoted. Corporations don't just sell products, they shape the conditions in which we make choices. They lobby governments, fund research that casts doubt, and engineer products to be addictive, all while shifting blame to individuals. Understanding commercial determinants means seeing the health outcomes shaped not just by personal choice, but by the broader economic and political systems in which these choices are made.
I recognize that commercial determinants is a little bit of public health jargon, which might be familiar to this audience or maybe not, but just to sort of define it, it's really just the impact of corporate interests and their political, financial, and social power around public health. And there are a few ways that there's actually lots of ways that corporations impact public health. And I'm thinking maybe I'll talk about that briefly so that I can backtrack to answer your question of what would look different if public health actually addressed this head on, right? So I think that corporate interests cause direct harm to health, right? From the products they manufacture, when you think about the tobacco industry, alcohol, certain food products, etc. The products they manufacture in and of themselves can cause harm, often are polluting environments in producing whatever they're producing. So even if the products are not directly causing harm, the ways in which they are manufactured and distributed often cause harm. There's harm in their labor practices, the way that they are treating workers in the US and especially globally, and what that looks like. On top of all of these different types of harm, there's also, I will say, like the political lobbying piece. I know you alluded to that earlier. Just all of these ways, both direct and indirect, that they're causing harm and getting in the way of advancing public health. And on top of all of that, they are also gaslighting us, right? They're trying to distract us, deny, deceive us from recognizing and fighting back against the harms they cause. There's so many examples of corporate interests, right? Falsifying research, hiding what they know to be true around the harms of their products. And then one really insidious thing they do is cast blame back on individuals, right? If everything is about individual choice, then the blame is on the individuals and not them. So they kind of shift our narrative around health to be one that's really focused around individual choice instead of all the ways that corporate power is shaping what choices are even available to us. So again, all of these things are shaping those social determinants of health and shaping our health. And I think what we in public health can do differently is explicitly name the impact of corporations and corporate interests, and then start to get both more strategic and more collective in how we work to break down corporate power, and on the flip side, how we work to build community power. This goes back to something you were saying earlier, Purva, about once you recognize all of this impact of corporations on public health, it is really easy to feel powerless. And one big thing that I want to get across to folks, and again, this is why Gaslit by Corporations, Ignited by Community, right? One big thing I want to get across is that while we may feel and even be powerless alone, we are not powerless together. I think so much of this boils down to what is essentially a massive collective action problem, right? How do we all work together and organize and, again, get strategic together about how do we fight back against these things? So I think if public health can really make building community power and breaking corporate power more a central part of our strategy, I think that we will feel a lot less stymied and frustrated in our efforts to change policies and systems.
That's such a fair point. And I think what you mentioned with the difficulties in that collective action, I think we've been seeing a lot of that. And that's a whole other podcast episode on really how to work around that, especially in the current climate of individualism that we have.
Yeah.
And so I'll pick your brain on that a little like later on when I need conversation, because I know today's not really about that specific deep dive. But, you know, you've mentioned smoking a few times as an example, and other ones come to mind. I know we've got the opioid epidemic, we've got PFAS, like the Teflon and things like that. There's so many examples out there, and it seems like it just keeps happening. Like we're constantly almost fooled by the same tactics over and over again, even when the blindfold is lifted. I'd say the tobacco and smoking one is one of the biggest ones that happen, and our eyes were open to it, but it's almost like every generation has its own version of that. So maybe we can walk us through an example, like picking a specific industry or product or issue, whether that's like exercise or smoking. How does commercial interest in that actually become a health determinant on the ground? Like, what does that flow chart almost look like? How does it turn into a health issue?
I think there are so many examples of this. I think in some ways, tobacco is a really obvious example, both because of the kind of indisputable health harm of the product itself, and because it is an example, and there's a blog post on the Gaslit website that sort of walks through some of what we've learned from fighting the tobacco industry. It's also one where we collectively in public health have walked a little bit further down the road of actually fighting that fight.
So how do we fight back? Vinu's answer is simple. We can't do it alone. While individuals may feel powerless, communities are not. The real antidote is collective action. Look at the food industry. What's on grocery store shelves? What's affordable? What's marketed as healthy? These are all shaped by decades of corporate strategy. Agriculture subsidies, marketing, lobbying. The food industry has engineered the conditions all along. But if we can see the strings, we can cut them. That's where community power comes into play.
So I might actually pick a different example for us here now. So I think a lot about food companies, right? And you think about everything, right? Like you walk into a grocery store and what is on the shelves, what is in the checkout aisle, all of those things are shaped by these corporate influences behind the scenes. And I think oftentimes this is the narrative that they are trying to shape around, like, your nutrition choices are yours, right? That it's all on you. But when we walk into a store in our community, our choices are being shaped by all of the work and money they have been pouring in behind the scenes around where products are placed in the store, how cheap or expensive they are. You start thinking about agricultural subsidies and how that's influencing what is manufactured or not manufactured. You think about the way a lot of unhealthy processed foods are designed by experts in chemistry to be addicting to us. You think about the lobbying that happens. There's been some efforts around, for example, taxing sugar-sweetened beverages, and that industry has come out in full force to lobby against that. So you start to see all of these pieces of behind the scenes influence that then shape our environments, shape our choices, shape what's available to us. And I think that's really the piece that we have to get to. And it also gets to a lot of public health efforts, right? And I'm not saying any of these are unimportant, but just that they are insufficient. So when you think about public health efforts around food and nutrition, a lot of times these efforts are focused on education and information. Sometimes they might go a little bit further to address food access in a community. But I've seen over and over again, they often don't go so far as to address what the food industry is doing head on, to really call out and fight back against their lobbying, their financial investments, the way they're placing things in stores. Also just the market consolidation, right? You walk into a grocery store and like 75% of the stuff is really from like 3 or 4 companies. So then you think about the outsized power that they have in our food environment.
That's a really good, recent example of a particular industry that's almost gotten worse in recent years. I think there's so much, paid advertisement by influencers and all this type of stuff that really also affects our brain and the way we think about food and nutrition. It's really hard to know what is good advice and valid actual nutritionist advice versus not.
And a lot of that, real quick on that point, because that makes me think of 2 other things. So one is that part of the problem, right, is that oftentimes what is best for our health, right? There's not as big of a profit interest or motive behind that, right? Why do we not see fruits and vegetables branded and advertised for the way that we see the other products branded and advertised for, right? So there's sort of an inherent challenge of where the profit lies. But the other thing that you're saying that made me think about is when we are walking into our food environments, our stores, our communities, and what we see, There's a lot of other behind the scenes influences, right? So the food companies are publishing a lot of research that is questionable to say the least, right? They're funding a lot of research to cast doubt. In addition to funding research and casting doubt and adding all of this kind of murkiness to the way we talk about nutrition, you see like Coca-Cola and these soda companies funding physical activity programs, right? They're trying to really say that, hey, the problem is over here. It's not us, right? If the problem behind our obesity crisis is physical activity, and really that's where the focus should be, they are intentionally taking the focus off them, right? Like, don't look at the sugar sweetened beverages, don't look at the processed foods, let's go look at physical activity. So again, there's all of this insidious deception, denial, all in the works behind the scenes.
Why is this strategy so effective? Look at tobacco. For decades, the industry engineered an entire environment that made smoking normal and desirable. They manipulated nicotine levels, funded experts to cast doubt on cancer evidence, and saturated marketing across televisions, magazines, and sports. They framed it all as individual choice. As a result, smoking became culturally embedded. That same playbook is happening now with food, alcohol, and fossil fuels. It works because we live in an individualistic society primed to accept personal responsibility. Corporations exploit this. Breaking that cycle, shifting away from individual blame and to collective action, might be the most important public health move we can make. What I wanted to talk about next is that pattern that you already described, like corporations deflecting blame to individuals.
Yeah.
Why is that strategy so effective, and how does it prevent us from making real progress in public health?
Yeah, I think it's so effective. It goes back to something you said earlier, which is just like the individualistic lens and culture of our society right now. And this is something I've been thinking so deeply about on both sides of this equation, the corporate power side and the community power side, right? On the corporate power side, exactly what you're saying, it makes it so much easier for them to deflect blame because everyone is already primed to accept this story of individual responsibility because it's so steeped in our culture and our lens and all of these things. And then on the community power side, that individualistic lens also gets in the way of us building community power. I've been thinking so much lately about how in order to organize strategically as a community, we first have to be connected as a community. And even that community connection is frayed and dismantled right now for a whole number of reasons that I could go into. But for now, I'll just say that individualistic lens and culture is both what makes it easy for corporations to deflect blame and really make it about the individuals. And it's what makes it so much harder, much more of an uphill battle for us to build the community power we need. But I absolutely do think there is hope and there is a way for us to begin shifting this narrative. That's really what Gaslit is trying to do as well.
So where does this leave us? We've traced the invisible strings of corporate power. We've seen how they shape our food, our health, our choices through the deliberate design of products, policies, and narratives. We've felt the frustration of working within broken systems. But Vinu's message is one of hope. Change is possible. Narratives can shift, and ultimately, communities can organize. Coming up next, we're diving into the final part of my chat with Vinu, into the concrete strategies, the real-world examples, and the paths forward for public health professionals and communities ready to reclaim their power. That's next time on the Public Health Insight podcast.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art designed for our show by LaShawn Benedict. The Public Health Insight podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.